and welcome to the show today, Healthy Living. I'm Kaylene Cornell, Health Education Coordinator for the Purchase District Health Department. One of the important services we provide to our community is the WIC program. This is a supplemental foods program, so it doesn't provide all the food, however it does help with assistance in buying those groceries. We will be talking about who qualifies and what foods are included and the formula and how breastfeeding services are also included in this. We will also be discussing the benefits of breastfeeding to mother and infant. We have Kelly Alsip here, who is the WIC coordinator and nutritionist and lactation counselor for the Purchase District Health Department. Thank you, Kelly, for coming today and talking about this. Could you start off in explaining what does WIC stand for?
Well, WIC stands for Women, Infant, Children. It also, women is considered women who are pregnant or have just had a baby, meaning breastfeeding, or just postpartum if they're not breastfeeding. But that's what the WIC program does stand for.
Okay, so who would qualify for this then?
Income eligible, depending on household size and income, and of course, if you have the medical card and qualify, you can qualify that way also.
Now, do the doctor clinics, are they helping people, decide whether they are able to be eligible for the program, or?
No, they really don't. Sometimes they'll give us referrals, or they'll tell people about us. But as far as helping us tell us if they're qualified, not really. But they do tell people about us, and as well as the hospital.
Okay, all right. So if people are questioning, they could just call the health department, right?
Absolutely. You can call, you can tell us your household size and income, and over the phone we can tell you if there's a good chance that you would be eligible, but also if you have the medical card, there's a very good chance. So.
Okay. Now I know it's very important for the health of the baby during the pregnancy, so is there some nutrition counseling that families can get through this program?
Absolutely, absolutely. It's a basic nutrition counseling that we give them. We go through kind of a risk assessment type of tool, and I talk to them, and as well as nutritionists and some RNs. We talk to them, and once we find out their risks, then we can refer them out if they need more in-depth nutrition counseling to see like for medical nutrition therapy, or if they need other services, counselors, to see medical doctors and things like that.
Okay, good, because it's so important to have not everyone, well, I mean, just to know the importance of the different fats in the foods, and what a child and an infant would need for a healthy
Absolutely, and that is something that a large population of people do not know. Basic nutrition for their children, or basic things about infant needs as far as diet goes and things like that. So I have found that we are their first resource. First-time parents especially need a lot of information, and we have counseling, we have pamphlets, we also have other service referrals and things like that to doctors if they need that. But I think that we are a very big part of that portion of our community, getting information out to those patients. Absolutely,
especially with the baby's brain growing so fast during the first few months. It's so crucial.
And it's something that they need professionals to be able to tell them what to feed the baby, not their grandparents and not friends and family, because things change over the years, and what grandparents did and what my parents did and what friends do is not always sometimes the right thing. And it's not that anybody did anything wrong, we just have more information now and we know better now. And so sometimes just saying, no, we don't need to put cereal in the bottle to make them sleep through the night. We don't need to do baby foods at 1 month and things like that are things that, you know, they have other people saying, oh, do this. And, you know, that's something that, you know, it's a good service to them to be able to say, we need to hold off a little bit longer on these things. And the babies just need breast milk, or they just need formula until they reach 6 months old and things like that. A lot of people will thank us and say, you know, I've been told so many different things. And it's a service that, you know, makes you feel good sometimes. That's, you know, I've actually told somebody something that they're going to use.
Sure.
So
absolutely, yeah, because there's so much into learning how to raise a child and how to be a good parent, and this is just one of the important aspects.
And they want to be a good parent, and they listen to you. You know, there's, you know, you'll get those few that doesn't want to, but you know. But by and by, they want to know how to do things right. And, you know, if you tell them, you know, this is how it is, and give them paperwork to show them, you know, this is what the American Academy of Pediatrics recommends and things like that, it makes them feel good for them to be able to practice how to be a good parent and to be able to feed their children and their babies the way that is healthy, you know.
Yeah, absolutely. Now, I know excuse me, the WIC program has a lot of foods. I mean, it's great to see how many even vegetables are included in it. Could you talk a little bit about what are some of those foods that are available in the program?
Well, we have came up in the world. For years, it was juice and cereal and eggs and milk and cheese. And we have done a 360 turnaround. We are now providing fresh fruits, fresh vegetables, whole wheat bread, whole wheat tortillas, brown rice. We provide milk. As always, we provide milk and eggs and cheese and cereal. And now we provide baby foods and baby cereal. And that's something, all of this has just changed in the past few years. It hadn't changed in many years before that. So we've kind of had a huge overhaul as far as our foods and what we provide goes. And we've actually even had a new card system implemented also. So you don't have to carry around you know, several different batches of vouchers for each child. They're all on one kind of like a little debit card. That it's not a debit card, but it's, you know, you scan it, and you know, it's so much easier to keep up with, and they're not as easy to damage. So that's another big thing that has came about in the past couple years that WIC has really been trying to improve itself.
Good, good. And I would think it would be kind of, I don't know if it would bother someone to have other people know that standing in line that maybe, you know, that card, it's not as obvious.
Right,
you
right,
know?
it's more
and
discreet.
It's important. If you need that assistance, you need to have it.
Right,
you know,
and it's not something to be ashamed of, you know. That's, a lot of people will say, well, I only want it for myself, or I just want it for a couple kids if they have multiple, you know, and I'm like, you know, it's fine. You know, if you've worked, you've paid taxes, taxes pay for your WIC. So, you know, it's something to, you know, if you need the help, we would much rather your children and yourself be healthy than, you know, maybe to have some of the self problems, you know, that get that out of the way, because you're just being healthy for your family.
Absolutely, and it's there to be used.
Right,
you know,
right. Those kids will want that
properly.
money some other day, so that you'd be spending on that milk. So, and everything's getting more expensive.
Yeah, yeah. Especially the fresh vegetables. I mean, you know, so it is hard sometimes to, you know, to get that food on a low budget.
Right,
you know,
right,
so.
and it's and learning how to use it is another kind of a neat thing. I am able to work with patients that didn't buy fruits and vegetables, or not very many, maybe just apples and bananas and things like that, you know, and now they're being able to broaden what they get and try new things, try avocados, try new recipes with some of this stuff, because you know, you're able to get it now.
Right,
So.
yeah, that's great.
Yeah.
Now, how about the formula? I know formula has been covered. Is it the family's choice, or is it the doctor's choice? Who, with being on this program, how can you choose the formula?
We are under contract with Carnation Good Start Formula, or it's Gerber Good Start. Sorry, it changes companies a lot. It's Gerber Good Start Formulas is what we provide. It is kind of a basic formula that comes in several different forms. It comes in 2 different forms of milk base. It's got a reduced lactose and a soy form. So it does cover the basic amount of the population. Special needs babies, premature babies, we may work with the doctors a little bit with those, but by and by, Gerber Good Start is what we give.
Okay. Now, for mixing formula, I mean, how you mix it is how good the formula is going to be. So it's very crucial that you mix it correctly, and there is no way that you can cut corners by mixing it.
Always follow your can's directions. You know, depending on the type of formula that you have, if you do concentrate, if you do powder, you know, those are both mixed different ways. And concentrate does not mean ready to feed. A lot of people just look at it and think because it's liquid that it's ready to feed. No, you mix part to part, an ounce of water to an ounce of formula. You know, that's the concentrate. So, but babies need either breast milk or formula till 1 year old. We don't need to be doing whole milk at 6 months old because that's what our moms did, or because the baby's drinking too much formula and we're running low on it, so we need to fill in a gap. Babies need breast milk or formula till 1 year old. We don't need to cut corners. We don't need to mix formula with milk. So that's something that I hear, you know, pretty frequently. My little bit older babies tend to get transferred a little bit too soon, I think. That's something. And with breastfeeding, a lot of people have questions about that too, as far as how long to breastfeed. Like I said, babies need either breast milk or formula till 1 year old. After that, if you want to breastfeed beyond a year, have at it. You know, in the American Academy, there's a new press release actually that was produced by the American Academy of Pediatrics that actually recommends that, you know, extended breastfeeding is very health beneficial. So, you know, 2 years, and, you know, if you want to go beyond that, that's to each their own. That's controversial, I know. Actually, the American Academy of Pediatrics is recommending extended breastfeeding to 2 years even. So but I always say a day, a week, a month. If you can make it to a year, beyond that's wonderful, but any breast milk is better than no breast milk. So, you know, I am not the type to be, you got to do it this long. Especially with the people I work with, having some support systems sometimes are not, you know, really there intact for them. So, you know, if I could get them to do it while they're in the hospital, I'm happy. If I can get them to do it a month, I'm happy. If I can get them to go a year, I'm ecstatic. So, you know, but as far as dates, I always say, everybody asks me that, they need breast milk or formula to a year. So if you stop breastfeeding at 6 months, then you're going to need to pick up formula from there on out, and there you're going to start spending money. Because that, like you said, WIC is a supplemental program. We do not provide all of the nutritional needs for your child or your baby. And what that means is, a lot of babies I see that are on formula, we do not cover all of their nutritional needs. They will be out of pocket. A lot of times, on average, about 3 cans a month. So you can kind of multiply 3 cans times 12. So, you know, that's not cheap. Because formula, on a good day, formula might be $12.50 a can for our normal baby formula. Now those gassy babies, those special needs babies, those premature babies, those formulas can be $30 plus a can. So multiply 30 times 3 times 12. That's what we don't cover. So you can't beat free with breast milk. So absolutely, I really try to get that point across, that yes, you are on WIC, and yes, we do give formula, but we will not give you all of what your baby will eat as far as formula goes. And children too. A lot of people will say, well, why don't you provide this? We're supplemental. We provide some of the nutritional needs. We don't provide everything. And that's a misconception, I think, that a lot of people will have. Well, you provide this, why don't you provide more? Well, you know, we've got to be able to provide for a lot of people, so we can't meet all of their nutritional needs.
Right, so. Yeah. So how does WIC support breastfeeding?
WIC supports breastfeeding in several ways. First line is counseling, information. I talk to pregnant women that come in. I talk to them in depth, actually, and I kind of joke with them when they come in. They're not expecting it, but I'm really one of the only people that talk to them about it, other than their friends or their grandparents or their parents. And to a lot of people that I talk to, that isn't normally a good thing, because there's a lot of negativity about it. There's a lot that people don't know about the benefits. They'll say, oh yeah, I know it's more healthy, but I've got other people that need to feed my baby, or I've got, you know, some issues as far as putting the baby to the breast. You know, that's a weird thought, because, you know, there's a lot of young people, and breasts are very sexual in our culture. And I understand that. It's a hard thing to get over, a hard thought to get over. And we have a population of people that were ahead of us, as far as, you know, the older populations of people, who it was not a up-and-coming thing to breastfeed, and it was kind of a looked down on thing, or a impoverished thought, because if you didn't have the money to feed formula, well, then you breastfed, or it just goes through cycles, it seems like. And so we have a lot of boundaries as far as that goes. So I think informing my pregnant mothers of the benefits of breastfeeding for the mother and for the baby and for your budget, and talking to those daddies that might come in. I love it when I have daddies in clinic with me, because I really talk to them. And that's something that a lot of people are like, you talk to the dads? Yes, because they are mama's support system.
Yeah,
I talk to grandmas that come in with them that may be, you know, in their ear, because grandmas really help with babies. In a lot of circumstances, grandparents may be the primary caregiver while mom's out, you know, working her job, or, you know, going to school or something like that. So getting grandparents to be positive with my moms is a big thing, and daddies. So, you know, talking to them is a big part of my job, I feel like. And I feel like if you don't talk to new mothers about them, you know, doctors and hospitals and things like that, I think that you are performing them a disservice. It may take longer to talk to a breastfeeding mother, because you got to teach them. And formula is a little bit, as far as the medical profession, I see a lot of people will have a little bit of a push there, or in the hospital, because you got to work with a breastfeeding mom a little bit more, and that's something that some people are great about, and some people maybe didn't do it themselves, so they don't feel comfortable talking about it, or they don't feel comfortable, you know, working with it. But it's something that has got to be done, because there's, you know, a health crisis in America with obesity and, well, and economic. You know, there's so many more people out of jobs and things like that, that, you know, they need to breastfeed. They need to try it.
Yes.
You know, that's the biggest thing. If it's not for you, so be it, but you don't know unless you try. And that's the biggest thing that I talk to my patients about, is give it a shot. You know, and I have had mothers come in that have never breastfed any of their children, and they have multiple children. And the best way I can explain to my new mothers that have never done it is, I've had mothers come in that have formula fed 3 babies or more. And I'll talk to them, and they'll say, okay, this is my last one, I'll try it.
Sure.
I've had more than one mother come in tears, saying they missed out on their other children. Okay? That's the best emotional way I can tell you there's a difference between the two. That's not to say that there's not a bond between a mother that's formula feeding and breastfeeding, or, you know, between their babies. It's just a different experience. And that's the emotional side of it. As far as the health benefits, the mother has much quicker weight loss. You can count on about 500 calories a day. So it makes that baby weight come off a lot easier. They also have decreased risk of female cancer the longer they breastfeed. Breastfed babies have so many benefits. They have decreased risk of of obesity. They have decreased risk of allergies, asthma, ear infections. A new study just came out showing breastfed babies have decreased risk of childhood leukemia. That's cancer. That's a gift you can give your baby just by what you feed it.
Yeah.
And again, if for no other reason, you can't beat free.
Right. Yeah.
So it's just a wonderful experience. And you know, trying it, for some women, you know, they can't get over some of the sexual aspects or, you know, the thought of it. And I understand that, you know, not everybody it's for, but it's worth trying. It's worth doing it a day or two to get your baby your colostrum. Colostrum is kind of the first milk that you produce. I kind of think of it as milky honey. It's really thick, kind of. It should never be even measured in ounces. It should be measured in teaspoons. But it is antibody dense. It's very important for a newborn to have. Premature babies, it's very important for premature babies and full-term babies. It's very important for all babies. So that's my biggest thing. If my moms that can't get over, you know, the thoughts of it and so on and so forth, at least do it a day or two. Get that baby that colostrum in. The longer they go, the better, but those first several days are very crucial. And they're also very crucial to your milk supply. If you are wanting to breastfeed, it's very important to put that baby to the breast as much as possible whenever it wants to go. No feeding schedules. That's a big thing that I see a lot of grandparents push is you need to put that baby on a schedule. If you want to get any sleep, that baby needs to go on a schedule. No, they're wrong. At the time of birth, your baby's belly is the size of a marble. It fills up quick, it empties out quick. Your baby's going to eat frequently. It doesn't matter what you feed. I see it with formula feeding babies. I know more about formula than most people you will ever meet. I know more about breast milk than most people you will ever meet. So I'm a pretty good resource as far as it goes, and I see it with both. It doesn't matter. But I see it happen a lot with formula. A lot of people want to change formulas rapidly because they want the baby to sleep through the night, or the baby spit up a little bit. Well, baby spit up. Okay. Yeah. You know, but or that, you know, the baby.
Or if they're crying, I know that's one of the things, you know, with breastfeeding. It takes a while to get that supply and demand. You know, get the breast milk built up, and so it's not something, you know, you can do for a couple weeks and think you've got it. You know, it takes a while to work at it.
Yeah, and every baby's different. You know, I see babies that are naturals. They were born and they know how to do it. They've got it down and you go with it, you know, and I see babies and moms that have to work with it. So, you know, there's, and I always say supply and demand. The more you put the baby to the breast, the more milk you will make. You know, people who say, well, I want to do both. Yes, you can. Absolutely. You can breastfeed and you can use formula. But let's wait on that for a little while. Okay, we're not going to do, let's get it a good week before we do artificial nipples, because that's something that a lot of people are concerned with, is nipple pain and things like that, because they hear their friends talk about it, you know, well, I tried to breastfeed and it hurt, or they heard moms, oh, I tried it, don't even worry about doing it, it hurt me. Well, you're not your mom, you're not your cousin, you're not your best friend, okay? You are different than them, and your baby will be different than those babies. So you try it for yourself, and maybe hold off on bottles and pacifiers for a week or so, okay? Because you know, you are different than those other nipples, okay? And baby's brand new. Throwing too many things at it can cause some issues. Now that said, if your baby's given a bottle in the hospital, that doesn't mean you won't be able to breastfeed. It just may give you a few extra steps in your process. But that is something that you might want to talk to the hospital about whenever you go in to have your baby. Tell them, I'd like to try breastfeeding. Have them put it in your chart. Have them put it in your baby's chart. Hold off on bottles and pacifiers. That way maybe you won't have to, you know, cross that bridge. Yeah. You know.
Do you think we have enough support with the doctor clinics and the hospital promoting breastfeeding? Because Kentucky is really not as, you know, the percent is much less in Kentucky than in other states. You know, there are other states that women are breastfeeding a lot more than Kentucky. So, you know, I'm trying to figure out where is the issue?
There's a breakdown. There is a breakdown of communications between doctors and their patients, between some hospitals. I will say there is a push for breastfeeding, especially with the NICUs that have came about. There's a big push for breastfeeding that is very surprising and happy. It's a good thing. But there's also in other places there's a breakdown of breastfeeding information. There is a lot of staff that's not trained on it, and it needs to be. If you're going to be working with postpartum mothers, you need to have breastfeeding training, because you know, you are sometimes what can make and break a breastfeeding experience with a new mom, because you know, there's a lot of different things that can happen in the hospital situation, positive and negative. And I hear about it a lot, you know, because I get women that normally have already chosen what they're going to do by the time they get to me once they've had the baby. And I hear a lot of different things, positive and negative, about, you know, their nurses that they get, or how they were treated and things like that, or their OBs whenever they're trying to ask questions whenever they're pregnant. You know, how the OB reacts to it. So there's a lot, and it's some people are really great with it, and then some people are really not. And it's like they don't want to bother with them. They don't want to do that extra step, that extra work with them. And that's something that they got to do. It's their duty to learn how to do it. Whether they have to do extra work or not, they need to do it.
Absolutely, because it is so important, as you've mentioned, you know, earlier, how much a baby gets out of breastfeeding, and how much the mother does, you know. So it is definitely a very important you know, thing that our community, the hospital, the nurseries, the doctor clinics, we all need to work as a team to educate the mom so she can make that choice. You know.
Absolutely, that's the biggest thing.
Yeah. Well, thank you, Kelly. This has been great, and hopefully it's answered some questions to women who are thinking of becoming pregnant, or maybe are pregnant right now and are questioning whether they want to do this or not. And they can call you and talk to you about it. Is there a number that they could call?
Yes, I'm located out of the McCracken County Health Center. Our number is 270-444-9631. If you happen to be in a different county, we have health centers in each county, so you can contact your local health center too if you need more breastfeeding information, or talk to your obstetrician, or both hospitals I think do have breastfeeding classes. I know for mothers that are pregnant. So.
Okay, well, great. Well, thank you very much. Remember, a baby's health doesn't start right at birth, but also during the pregnancy. So it's important to search out assistance if you are eligible, and remember to talk to your doctor about breastfeeding. This decision will definitely, as you know today that we've talked about, helps the baby and the mom. It's not just someone else's decision. It really is your decision as to what you want to do, rather than what your grandmother or what your mother did. Thank you for listening to our show today, and thank you, Kelly, again for coming.